Okay, in this video, we're going to talk about what exactly to expect from the moment you wake up in the recovery room till a few weeks after abdominoplasty or tummy tuck. So abdominoplasty is a wonderful procedure. It tightens the belly tissue, and it's really the most powerful procedure we have, especially for folks who've lost a lot of weight or have just genetically loose skin and unwanted tissue there, or folks, of course, who have given birth previously as well. And so typically what we do during a tummy tuck is we're going to remove all the extra skin on the outside. I usually add in some lipo to help contour. For example, with feminine identifying folks, we'll be creating curves, usually with masculine identifying folks getting rid of curves while we're in there, and helping improve the overall athletic look of the abdomen itself after surgery, so it has a nice contour and not just a flat unnatural look. And so typically the other step we'll take if needed is we'll tighten up the abdominal muscles. This is typically needed especially in folks who've given birth before, but sometimes it's needed in folks who've never given birth as well. And usually we'll use a very strong stitch to tighten up either above the belly button, below the belly button, or both in order to bring the abdomen in. So after that, during the surgery, we're going to inject some local medication into the patient's abdominal wall, and what that does is helps block pain after surgery. So usually the pain is maybe not as bad as you were thinking. In my practice, we never use drains, so we're going to then place a bunch of internal stitches to close down the dead space on the inside. And typically while you're asleep with the tummy tuck, in order to tighten everything up as much as possible, we're going to bend the bed up just a little bit. And usually for the next few days after surgery, it's not unusual to be bent over a little bit. It can be a few days before you're able to stand up properly, but I promise you that ability always comes back. And so typically when you wake up in the recovery room, most folks don't have much pain. If you have pain, we'll give you something right away. And typically most of my patients take some painkillers for the first few days until we can substitute in ibuprofen and or Tylenol. And ideally we like to have folks off the pain medicine after a tummy tuck, usually about 4 or 5 days after surgery. Typically around that time you're just taking maybe one at night to help you sleep. A lot of surgeons now, especially after COVID-19, were super careful in order to avoid blood clots. So typically with most of my patients who are getting abdominoplasties, the next day after surgery, we're going to start giving you shots of a little blood thinner, which you're going to be able to do at home. Most tummy tucks are done as outpatient procedures, meaning that about an hour or two after you wake up, as long as everything's going well, you're going to head back either home or to the hotel or Airbnb or wherever you're staying. And obviously you just need an adult to be with you at the very minimum for the first 24 hours. But really, if at all possible, it's best to have somebody around for the first few days. Now, the first few days, you're going to be moving very slowly, but you're able to go to the bathroom by yourself. A couple of things to look out for, especially because we do liposuction during these cases. It's not unusual to have fluid leaking out of your incisions in the first couple of days. And we actually want to see that. We put fluid in when we do liposuction, so it's good when it drains out in the first couple of days. It makes a mess, but it's good because it helps bring down your swelling. A lot of the time after surgery, you'll have a binder on you, and then all your stitches will be dissolvable underneath. Typically the earliest my patients shower is usually 48 hours because we have to make sure you're strong enough to stand up in the shower, because if we do it too soon you might faint, so we want to avoid that. Usually I'll see folks back in the office maybe 2-3 days later, typically, just to check on everything. Most of my patients take at least 2 weeks off after abdominoplasty, but it really depends on the type of work you do. More commonly it's 3 weeks or even sometimes 6 weeks. And if you do a lot of heavy lifting or physical activity in your job, it can even be 2 to 3 months after abdominoplasty, just to make sure you're healing well. I hope this explains things, and keep following for more information.